All right, today's report is 3,349 new cases of COVID-19. Now, that is a lot, but it is still less than last week. And our positivity rate is down a little bit, but it's still pretty flat at 8.45%. Hospitalization up a little bit, 1,817. 431 Kentuckians in the ICU, 254 Kentuckians fighting for their lives on a ventilator. New cases by county, Jefferson, 475. Northern Kentucky has gotten hit hard. Kenton, 178. Boone, 171. Campbell, 119. Fayette is here with 126. Pulaski County, multiple days of high cases, 106 today. Hardin, 103. Davis, 94. Madison, 86. Warren, 80. Wayne County, 70. Laurel, 57. McCracken, 57. Shelby, 57. Pike, 56. Oldham, 48. The others can be found on kycovid19.ky.gov, but every single area in the state has multiple counties with 30 or more cases. Remember, it's everywhere. All right. So our death report today is going to be one of the hardest since early on. It's by far the most people that we've lost. And remember, that's a reflection of where this virus was about 3 weeks ago and where it was trending, because increase in deaths follow increase in cases. More people get infected, a percentage of those will be hospitalized, and a percentage of those will die. So the more people who get infected, the more people need to go to the hospital, and the more people don't make it. I hope we don't have another day where we have 54 deaths. And this is going to be hard because these are 54 families that need our help and our compassion and our green lights, which is the color of compassion and renewal. They also need us to do better, to follow the rules, to follow the restrictions, because if you don't know someone who's been lost to COVID, if someone close to you hasn't been lost to COVID, or someone close to someone you know, then you're not listening, because it has happened all over Kentucky. Far, far too much loss. So today's loss include 2 individuals from Bullock County, both men, 167 and 172. They include a 94-year-old woman from Callaway County, an 83-year-old woman from Carroll County, a 47-year-old man from Casey County, an 81-year-old woman and a 69-year-old man from Christian County, 97-year-old woman and an 82-year-old man from Clinton County, 76-year-old man from Davis County, 92-year-old woman from Fayette County, an 88-year-old woman from Graves County, a 63 and a 68-year-old woman, both from Grayson County, an 85-year-old woman from Hardin County, 94-year-old man from Henderson, 85-year-old woman from Hopkins, a 64-year-old man from Hopkins, and a 98-year-old man from Hopkins. From Jefferson County, an 82-year-old woman, a 97-year-old woman, a 47-year-old man, an 87-year-old man. From Jessamine County, an 85-year-old woman and a 55-year-old man. From Johnson County, a 77-year-old man, a 66-year-old man from Kenton County. That's halfway through. 75-year-old woman from Knott County and a 79-year-old woman from Knott County. 75-year-old man from LaRue, 88-year-old woman from Logan, 88-year-old woman from McLean, Madison County. Madison County lost a 76-year-old woman, an 85-year-old woman, a 90-year-old woman, a 99-year-old woman, a 77-year-old man, and an 89-year-old man. Our hearts go out to Madison County today. From Mason County, an 83-year-old man and an 87-year-old man. From Monroe County, a 76-year-old man. From Muhlenberg County, an 81-year-old woman and a 77-year-old man. From Nelson County, a 61-year-old woman and a 52 68-year-old man. From Oldham County, 3 men, ages 75, 86, and 95. We lost 2 men from Robertson County, a 70-year-old man and an 87-year-old man. In Russell County, we lost a 63-year-old man. In Spencer County, we lost a 92-year-old woman. In Union County, we lost a 73-year-old woman. And in Washington County, we lost a 58-year-old woman. That hurts to read, but it doesn't hurt nearly as bad as these families are right now. This is a tough way to pass, not being able to be close to family. And it's even tougher to mourn. So let's be there for these families and let's recommit to do the right things so there are fewer families that go through this. Long-term care facilities, 194 new residents testing positive, 126 new staff, 35 additional deaths attributable to our long-term care population. Right there is why they are in the very first tier of those getting this vaccine.